Hi, I'm DrJason Tripp. I'm a chiropractor right here in Hermitage, Pennsylvania. I want to talk to you about how lower back pain can be devastating. It can cause you to not be able to go to work without pain. It can cause you to be passed up for promotions because you're not as productive when you are at work. It can cause you not to be able to sleep well, tired all day, changes your mood when you're that fatigued all the time, or just not be able to put on your pants properly without pain, or play with the kids, those kind of things. And so I know about this because I had lower back pain for over 23 years. I went to osteopaths and medical doctors and acupuncturists and every professional that I could find looking for answers. I got hundreds, if not thousands, of doctor's visits that I went to, and I just didn't get the relief until I implemented the 5-step protocol that we teach in our office. And so we're going to talk about that today and how you may be able to get your pain under control. So imagine for a minute if you were able to go to work without pain, or sleep without pain, or just get dressed without pain, or play with the kids, your favorite hobby, golf, whatever it is. Getting out of pain can really change your life. It changed mine. When we're looking at how the body works, we know that the spine and the spinal nerves actually affect the muscles, ligaments, tendons, and what have you in the body. If one of your spinal bones is misaligned, if it's twisted out of alignment, it can block or pinch that nerve. When it pinches the nerve, that will cause pain. I had pinched nerves in my lower back at 5 different areas, L1 through L5. And so all of the areas were pinched. It was causing pain to go down my leg all the way to my ankle. And so whenever somebody comes in and they say, oh, I have lower back pain, my first thought is we need to look at, is that spine misaligned? Is it out of alignment, pinching those nerves, rubbing, wearing, tearing away at the disc? And so if somebody has a problem where the bone is out of line and is rubbing and wearing and pinching on that nerve, it can develop up decay. Now, that can happen over years. The longer it's in there, the more damage is done. And so we want to make sure that the muscles get relaxed, that the alignment happens, and the disc gets back to its normal position. When it stays out of alignment, rubbing and wearing over a long period of time, it can develop into a permanent problem. Now, that would mean to some degree, for the rest of your life, you would have extra pain when you do certain motions. You may be fine when you have all the motions that you're at work. You may bend over to pick up something out of the garden, and all of a sudden you have terrible pain. And so if that is happening for the rest of your life, it can really devastate the quality of your life. So we want to make a change in that. And we found that over 90% of the time when somebody comes in and they realign that spine back to its normal alignment, you will actually see a difference in the pain, in the function, and in the quality of that person's life. And so, I had a young lady who came in to see me, and basically she'd been struggling with her lower back for years. And she had been to multiple doctors just like I had. I felt her pain. And then she'd been out of work for 3 years. Can you imagine being so bad that you wanted to, first of all, not have to work anymore or not be able to work anymore? And then secondly, that you were in that position for 3 years. Her income went down, her quality of life went down, her ability to really live her life has gone down. And, with tears in her eyes, she came to me and she just was like, hey, this is my last resort. I don't know anything else to do. I've been to every doctor that I could go to, and yet here she is, like almost begging for an answer. And, I wanted to really have an answer for her. And so we had to go through our 7-part exam where we start with the consultation. We look at the bones, the muscles, the ligaments, the range of motion, the disc, the x-ray, etc., where you're looking at everything to make sure you get an accurate diagnosis of what's wrong. Remember, if you don't know what's wrong, you can't help it. When you get your diagnosis of what actually is going on, then there's a chance you could help that person. Well, I did the exam on her, and I found out that I did have a misalignment. She did have a misalignment in her lower back that was pinching a nerve. And so we put her into the process, the 5 steps. And as we started to realign that spine, the nerve pressure started to come off, and she started to feel better. It took a little bit of time, but she was so happy when she got her life back. Like literally with tears, she comes in. I have a great testimony that she gave coming from it, and with tears in her eyes, and she's telling me how she got her life back and how she is able to do things again and play with her kids again and spend time with her hubby again. Like everything was just, life was new. I gave her life back, and that makes my year. That's like an amazing thing. That's why I do what I do, is to be able to see somebody's life change like that. And so that's why I made this video, is just to share that with you. But we offer a $47 new patient exam. And what it is we have a 7-part exam process, like we were saying we did on her. And that 7-part exam process includes doing the consultation, where I can ask a bunch of questions to kind of figure out what's going on and is this a problem that we help with. We also go through joint testing. We want to make sure if the joints are working properly. And so there's specific tests to find out which joint it is that's malfunctioning so we can treat that joint. We also do nerve tests. Which nerve is actually damaged could tell me how long it's going to take to rehab you. We also do muscle testing to find out which muscles are irritated, which ones are in contraction, which ones are causing your pain. We're also looking at range of motion, so we can find out which motion it is that's giving you the most trouble. Bending forward, backward, side to side, like which direction is it that gives you the most problem. That tells us which therapy it is to help you. And then lastly, we'd look at the x-ray, which will show me alignment of the vertebra, so I know how to realign it, and also the disc space to make sure there's not a disc compression going on or further therapy that's needed. So remember, it's very accurate. We're going exactly through what's wrong, what we can do to help, and then when we find all that out, the chance of helping, we have over 90% success rate with these cases. So I really want to encourage you to take part in this $47 exam. We're doing that for a limited time, and basically every month we can do 10 of these during that month. So we have 10 that we're able to do, and I recommend give the office a call at 724-342-2225 to get your time set up. Now, we also have a 2-part guarantee, and in the guarantee, the part number 1 is we value your time. So after filling out your paperwork, you'll see the doctor, that's me, in less than 7 minutes. And so we want to make sure that we value your time, we get you right back to the doctor, we want to make sure that you get everything that you need. Secondly, we want to make sure you feel safe, and so we have a financial guarantee as well. If you go through the exam process, the consultation process with me, and decide you're really just not happy with it, just a satisfaction thing, on your way out, let the doctor know, let the staff know, and we will give you a full refund of your $47 for the new patient special. So really trying to help you just to feel safe, help you feel like your time is valued, and make sure that you understand that there is a way to examine your body to find out how to help you to get out of pain. So if you're interested in coming down, I want you to call this number, 724-342-2225, and I'd be glad to take a look and help you.